Well, let's talk about all of this right now with the Health Secretary, Matt Hancock, who joins us now. Good morning to you.
Good morning. How are you?
Do you know what? Frankly, despairing this morning, Health Secretary, at the prospect of a second national lockdown. That's what's been mooted, we're told, by some sage scientists. It's in the Financial Times. 10 million people currently facing local restrictions right now across the population. How likely is it that we are going to see another national lockdown for 2 weeks in October?
Well, it is a very serious moment. The virus is clearly accelerating, and we've discussed on this. We've discussed many times that whether that is going to lead to an increase in people ending up in hospital. But unfortunately, the number of people in hospital has doubled every 8 days in the last few weeks, and so it is a very serious moment, and we're understandably looking at options. National action is a last line of defence. The first line of defence is what you were just talking about. What all of us need to do: hands, faces, space, and the rule of 6.
Okay, you say the number of people in hospital has doubled. The number of people who've tested positive for COVID who are in hospital has doubled. One of the great sort of spikes we've been seeing is in Bolton. How many patients are currently in hospital with coronavirus in Bolton?
I haven't seen the figure, but I have.
Two.
No, that's not true.
It's
So
two. That's what the official figures state.
no, well, that's not true. It's much higher than that. I've seen the shape of the curve. I don't know the exact
Shape of the
figure.
curve.
I can get
Okay,
back to you.
let's talk about shapes of curves, because we know that coronavirus cases are going up. But again, lots of people, including Carl Hennigan, Professor of Evidence-Based Medicine at Oxford University, who has helped to influence some changes in government policy recently, has pointed out these aren't cases of coronavirus. These are people who've tested positive for the test. What is the false positive rate on the testing that we're doing in the community?
Under 1%.
It's under 1%.
Yes.
Even around under 1%. Do you know the exact rate?
Under 1% means that for all the positive cases, the likelihood of one being a false positive is very small.
Yes, I understand I understand what under 1% means, but is that the exact? Do you have the exact figure for what it is?
We do.
You do.
I don't have it in my head.
Okay.
I know that the specificity, as it's called, of the PCR test is over 99%.
Because some very eminent people in this field have pointed out that even a false positive rate of 1.8%, so just double roughly what you're saying, would account for pretty much all of the daily positive tests. And there's a really easy way of finding out whether or not a test has been a false positive or not, and that would be testing the same person a second time, because the chances of them having false positives twice is very little. How many people are who have tested positive for coronavirus under these tests, which have this false positive rate? How many of those are tested a second time?
Well, we do that sometimes. Again, I don't have that proportion. But
I mean, is it 1%? Is it 50%? Anything?
No, yeah,
region of?
I don't have the figure. I'm not going to speculate. But Julia, I can see the thrust of the questions, and what I can tell you is that we take into account, of course we do, the issue of the very small proportion of false positives, and we also publish through the Office for National Statistics an analysis of the impact of that on the figures that we use. So I wish it were true that all the positives were false positives and that this wasn't happening, but it is. Okay. And the proof of the pudding is sadly in the fact that more and more people are going into hospital. There's now over 100 people on ventilators. There's 900 people with coronavirus in hospital across the country. That number is doubling every 8 days. Okay. So I know that there are people who are putting about this argument that actually we can all let it go, but unfortunately that will lead to more people dying.
I'm not one of those people saying we should let it go. It's a very serious disease and we need to take action. And you know, I'm not someone who thinks it's a global conspiracy or a hoax or anything. However, I, like you, I think should be listening to eminent people like Professor Carl Hennigan, who gave evidence to the Science Technology Committee yesterday and talking about the risk of the false positives and this test. You say 100 people on ventilators, and that's going up, and obviously 900 people with coronavirus. I mean, you, of course, being the health secretary, will know that every autumn, even when we've had a nice load of hot, sunny days, every autumn we do see an increase in the number of people going into ICU, going into needing ventilators. When we don't have coronavirus, it's happened last year, it happened the year before, it happened the year before that, and it will happen next year and the year after that as well. Some of those people will have coronavirus, and we knew that that would happen because when you come out of a lockdown, you're going to see the prevalence of the disease spread. Why was none of this predicted by anyone on your team?
Well, we do have a range of scenarios, including covering this one. So we did know that this might well happen. In fact, I remember very well, I was talking about this a few months ago when I said that there were three big moments. One, the start of July when we opened up hospitality. A second, at the start of September when schools came back. And a third, the start of December when the winter turns, because what you've just talked about in terms of pressures on the NHS going up in a normal way, which they do, that tends to happen from about the start of December. So absolutely, this is a moment that we always knew would be a risk.
So why are we reacting to this with local lockdowns and restrictions and talk of a second full national lockdown in October when this is not only entirely predictable, it was predicted? We go into lockdown, we come out of lockdown, we go into autumn, we will see a rise in coronavirus cases.
It's a question of degree. So we knew that this was a moment of risk. In fact, the moment of risk at the start of July was much less difficult than I expected, and that was great.
It's almost like the modelling isn't accurate, isn't it? Sometimes.
Well, we're dealing with an unprecedented disease. Modelling, of course, is an estimate. I mean, anybody who's lived through the last 9 months and says that you can predict the future with accuracy needs to have their head looked
But now we can't predict the future with accuracy, and we've learned that from the Imperial College computer predictions. And I don't know, I'm not somebody who thinks that we should never go into lockdown. I think at the time that was the right decision. I've been very, very quick to defend the government on that throughout the lockdown period. That we didn't know about the virus. We had lots of false information coming out of China. We saw the chaos in northern Italy. At the time, it seemed like the right thing to do. However, we don't have to rely on predicting the future anymore. We can look at what's actually happened, not with computer models, but with the real world. We can look at what's happened in Sweden. Can you explain to me why a country that has not had a formal lockdown, yes, plenty of social distancing, but schools left open for under 16-year-olds, bars, restaurants still open. Why Sweden right now, despite not having a formal lockdown and not even considering the prospect of one this winter, why have they got a lower rate of coronavirus infections, hospitalizations and deaths than we have?
Well, I've looked into this and, we've discussed it before. And Sweden has brought in legal measures to restrict social activity. And also,
very limited.
No, and also
they are very limited.
No,
tell me what they are that's so unlimited.
And also, the deaths are in Sweden from the first wave were 10 times higher than Norway next door, and we know that how densely packed your population is has a very big impact on your.
And we know most of those deaths were in Stockholm, which is a very busy city. Can I also ask you about Dido Harding? Dido Harding yesterday said that demand for tests has been 4 times higher than the capacity at 1 million a day. And she said that based on SAGE modelling, she did not anticipate such a large rise in demand when children returned to school. Everyone else predicted a rise in demand when children return to school. You were telling people only a few weeks ago, if you're any doubt, get a test. We know that when a child gets ill at school or a teacher, we're going to have that demand for testing. How is Dido Harding still in a job?
Oh, well, Dido Harding has done an excellent job of increasing the capacity of testing, and she is on track for that. And it's been a massive effort. The challenge is that we've had a whole load of people come forward for tests who aren't eligible for tests because they don't have positive symptoms.
But they had doubts, and you said to people, if you've got any doubts, get tested. They're just doing what you told them to do. I said, and our policy position all the way through has been, if you have symptoms, get a test. If you don't have symptoms, you shouldn't come forward to get a test, but you must self-isolate if you've been in contact with somebody who's tested positive. Unfortunately, then getting a test doesn't help you. You've still got to self-isolate because
of the risk of a false negative.
But thousands of NHS workers, care workers, teachers, pupils at school should be at home, not working and not learning because they can't get hold of a test.
Well, NHS workers have access to tests through the NHS route, so they should all get their tests from their local trusts. And of course, I want people who have symptoms to be getting the tests, which is why I'm so robust at saying people who don't have symptoms, unless they've been specifically asked to for a good reason, should not be getting a test. It's a really, really important principle that we have. We have this massive testing capacity now that in fact that helps us to manage this second increase much better than first time round, because we know where the virus is in a way we simply didn't the first time round. But it's very important that capacity is used for the people who really need it.
Just finally, I know you have to go. Final questions, really simple. Do you think the government's doing a good job on this?
Yes, and I think that we've got a massive challenge as a country, and we need to come together as a country. This is one of those big moments when we can all see that the number of cases is rising, and the whole country needs to do their part to follow the social distancing rules, the simple things, hands, face, space, the rule of 6, and that is the best way to avoiding further action. We'll take further action like I did in the Northeast yesterday. We'll take it if it's needed, but this is a big moment, and everybody needs to be alert.
Okay, Matthew Hancock, the Health Secretary, thank you very much for joining us.